Hi, and welcome to this installment of Frank and Mary here in Southborough. Actually, I'm not in Southborough. I'm on vacation on Martha's Vineyard, but that's the miracle of Zoom. You can do this from anywhere. So if you haven't seen the show before, you know that this show is, my day job is as an elder law attorney at Myrick O'Connell. I work up the street in Westborough. There are 70 of us. I do elder law. This is not about elder law. This is about my friends Frank and Mary and their goal in life, which is to live in their house until they die and be buried in the backyard. And if you identify with that and you want to just stay in Southborough forever, this is the show you want to watch. The point of the show is to really kind of talk to issues that may be of relevance to you and other seniors. It may be relevant to everybody in the community, but it may certainly be relevant for you folks. And that's why my wonderful co-host, Doug Peck, always finds these great guests that we have. We have two guests that we have had on before, but are going to talk about issues that are really relevant to all of us right now. So Doug, whom do we have today?
Thanks, Arthur. We have Betsy Connolly, who is the executive director at New Horizons in Marlborough, and Josh Obeiter, who is the executive director and owner at Seniors Helping Seniors of Greater Boston and Metro West. So the point of bringing these two on is that although, as you mentioned earlier, the president has declared that the COVID pandemic is over, people are still dealing with COVID. And I wanted to get a sense of what's going on in the independent and assisted communities and what's going on with home care, sort of what they see, maybe what lessons they've learned, and if they're doing anything different now, that that requires people to think about where they want to go. I mean, as people age, there's a lot of choices.
And I think, Doug, this is a great time to have folks on, because I was sorry kind of that the president framed it that way. But I know earlier in the pandemic, we was always said there was a point at which this is going to turn from pandemic to endemic. And it's just kind of part of the system, and it's going to be part of the system going forward. And, you're going to have to be more careful than you used to be. It's not this, but it's just not the same. So the notion of really having people on the ground who are dealing with this all the time, that's a great idea.
Yeah, good. So I'm going to turn first to Betsy. Betsy, can you give us a quick overview of New Horizons? Because it's a pretty big facility in the Marlborough area and certainly serving Southborough, et cetera.
Sure. Thank you, Doug. Appreciate you having me on today. Arthur as well. And welcome. Good to see you, Josh. Well, we have 400 apartments at New Horizons. Happy to say that we're pretty much fully subscribed. We're fortunate. We've been around for, 25 to 30 years. So we're well known in the area. And we have independent, assisted, memory care, and we have a geriatric psychiatric unit on campus too. So we are, we cover the gamut. And on COVID, I guess I'll just start by saying, after many, many months of not having any positives, in the last week, we've had 4 positive residents.
Really?
So we're definitely seeing an upward tick. We don't have any positive staff right now, but we have a handful that have come in to say that they have COVID positives in their household. Good news is, like someone, has said along the way, the symptoms are maybe a little bit less, although these 4 that have it right now, 2 went out to the hospital yesterday and haven't come back yet. And the other 2 have had pretty significant cold symptoms. I know I had COVID in May, and I spent a couple days at home, didn't feel the best, but wasn't really under the weather too much. But I would say these folks are a little bit more under the weather than people have been. We had a challenging, maybe I would say it was March, April, and May, where our numbers were up enough that we've continued to test residents and staff every week. We were fortunate to participate in a free federal government sponsored PCR test program. And so we're testing a couple hundred people every week between staff, residents, and in some cases, even some visitors who have asked to be tested. And then I guess one last thing I'll mention is that we recently signed up with a company called Concentrix to test our wastewater. So they're going to be testing the wastewater on our campus, just to see what kind of trends that might show. So it's still here. We're still dealing with it. I think when somebody tests positive, we give them a red dot. We put a red dot on their door. And that alerts everyone to know that we've got some positives, and therefore housekeeping, maintenance, others have to protect themselves before they go in to the apartment, and residents can't go to the dining room. And then we have to also we don't put a red dot in the door, but we put anyone who may have been in close contact with those people on notice that they should watch for symptoms. And I think we've got about 25 people on that list as of this morning.
So do you wear masks? Do you require masks through the facility?
We require masks in the assisted living building and in the memory care.
Okay.
And we recommend them in the other buildings. Unfortunately, with things being so good for a long time, it's tough to get the independent residents to continue to wear their masks. But everyone has to wear them. The EUEA still, requires them in the assisted living and in the memory care. Okay.
All right. Well, good. Well, that's a good overview. How are the residents feeling about the COVID? I mean, I know when it first started, everybody was very, very nervous and concerned. What's the attitude there like now?
Well, I think people are happy that unless they have COVID, they don't have to be quarantined. I mean, we're still letting people go to the dining room, even if they are positive. We're being a little bit more vigilant on reminding everybody that have their masks on their chin to put them up over their nose. I'd say people are not as anxious as they certainly were in the beginning, but, getting a little bit more cautious as we see the numbers tick up.
But you're watching things very carefully is what I take it.
Yep, I'm probably going to send a communication out sometime this week to all the families about the uptick in the numbers and reminding everybody what they should do about it.
Okay, good.
And can I ask, it has been my observation kind of in the broader population that while on the one hand, folks who were very nervous about COVID seem to be less nervous. On the other hand, it seems that on the other side, among the folks who were just deniers, who were just totally resistant to this, it seemed the whole issue seemed to be much more politically jazzed up. It seems like that's just calmed down in general, so that I found people are just more respectful in general about the fact that that others are being careful, and they need to be careful, right?
I would agree
and more
with that.
kind of polite. It's just there was that awful time when there was such tension on both sides, and it just feels like some of that's resolved.
Yeah, I get very little pushback now when we say to visitors, we need you to wear a mask. They know. I mean, we've spent a lot of money on masks. We spend a lot of money. I mean, while the federal government might provide the testing, material, and they do the test, we have to execute the tests. So we're spending a lot of manpower on all this stuff. And, I just continue to remind people that this is money that we're spending, our staff time, for their safety, and they need to respect that. And I think they are more and more.
So thank you. So Josh, what are you seeing with your clients that are at, in their individual homes?
Yeah, well, thanks again for having me on, and glad to be here with you, Betsy, as well. It's interesting. I would say the trends that you're experiencing at New Horizons are similar to some of the trends that we're seeing here at Seniors Helping Seniors. And that is that COVID is still certainly with us, but the severity in which people are getting sick and the fear has certainly lessened over time as more and more people have had COVID themselves or have had close family members with COVID, and they're recognizing that it's something that they need to live with, and that COVID will be here for quite some time. So unlike a community setting, we are working one-on-one with individuals in their private homes and sometimes in facilities as well. And for us, it's all about really tight communication with our caregiving staff about exposure and about positive tests, as well as with our clients. And, you know, because we can't be there at all times, we're relying on them to report to us whether or not they're experiencing any COVID symptoms and whether or not they're positive or not, as what we're finding for both our clients and caregivers on the rapid home tests, that there's often a significant delay for a positive test result to surface. So for example, somebody who is experiencing, you know, cold-like symptoms may not test positive until 2 or 3 days in, which can then have a ripple effect on the clients that they're serving. So for us, we're really encouraging our staff to not go to work if they're experiencing any type of symptoms, whether or not they've tested positive. In addition, we are a little bit looser when it comes to masking requirements, and we keep that kind of on an individual case-by-case basis with our clients, as we're not regulated by EOEA. And as many client families have requested that we do not mask because their loved one either has hearing impairment or a dementia diagnosis, making it more challenging for them to read lip or to understand, we kind of let the families determine whether or not our caregivers wear a mask. So really, our approach is open communication, lots of testing, and erring on the side of caution whenever we can. The other thing I would mention is the newest COVID booster has just become available. The bivalent booster that anyone is eligible for, and it's offered by both Moderna and Pfizer, is now readily available for the public to access. And we have encouraged all of our caregivers, regardless of whether or not they got, you know, 1 or 2 boosters, to get this new COVID booster, the bivalent, which is designed to protect people from the original variant of COVID, but also BA4 and BA5 and Omicron. So that's really our newest initiative, is to encourage both caregivers and clients to get that, as well as the flu vaccine, which is now available.
Can I ask kind of just as a follow-up to the both of you, now that everyone kind of has masks and there are masks that are around, do you think that there will be more of a trend even in the now we're heading into the flu season, right? You know, we're heading into the fall and the winter. That even if you've got, you know, like a flu symptom or a serious cold, do you think there'll be more of a tendency for people to just say, look, let's do everybody a favor and just mask up? Or if you're an employee and you've got those kinds of symptoms, don't come in, right? Because I think that's one of the, certainly that would be a change from pre-pandemic, where kind of the assumption was, oh, you have a cold, you know, you're just going to kind of push through it. And nobody ever kind of acknowledged that may not be a good thing for the community. You know, it's fine for you to be showing that you're macho, you know, but for everybody else, it's a pain because you're spreading the disease. I'm just curious, because once again, you're in the field and I'm just watching.
Well, I think I just say, to start off, yes, I mean, I think that it's logical. People noticed that there was less flu, less common colds last winter and the winter before, probably in part because people were wearing their masks pretty judiciously. I think, though, at the same time, there's a lot to say about the fact that people are, you know, not all are going for the booster shots. You know, we have our booster shot coming up on October 14th with the flu shot. That'll be, you know, a day for employees and the residents all to come forward and get the booster. It's going to be interesting to see how many got it. get it. I mean, we did not mandate the boosters. We mandated the vaccine for staff. You know, I think it was in April that the program that went away, that paid staff to stay home. So we're not going to have that program in place now. So if people get sick, you know, they used to sometimes get through it because they had to make money in order to pay their bills.
Right.
We went through a year and a half where people could stay home and be sick and get paid. And now that program has ended. So this winter, fall and winter, we'll see if we're really in an uptick, which it looks like we might be right now, you know, whether we can keep staff home, whether people will be willing to stay home because they need their paycheck in order to pay their bills. That's just a fact of life.
Are you seeing that too, Josh? Or-
Yeah, to some degree. I mean, we required the vaccine for all of our caregivers as well as all of our clients to ensure that we're keeping people as safe as possible. We did not mandate the booster, and we are unable to mandate the bivalent booster at this point. And I think the jury is still out to see how many folks do take advantage of the newest booster. There has been some skepticism regarding it because we've heard from folks that they still got COVID and they were vaccinated. So there is overcoming those objections once again about getting another vaccination that hasn't in the past proved to be as effective as once promised. So that is an obstacle that we plan on trying to overcome in the coming months. And, I do anticipate that there will be this continuous balance, so to speak, of wearing a mask and being protecting yourself and others, but also trying to carry on with regular life as much as possible. And I know how excited people are to take the masks off and return to a sense of normalcy and seeing facial expressions. And so I think it's that balance that we will continue to live with for the foreseeable future. And, along with what Betsy was saying, our caregivers tend to be in a slightly different financial position as they are often retired. And this work is supplemental for caregivers. So they are not as driven by the paycheck, but also they are eligible for paid sick time through our program. So we continue to encourage people to be as communicative with us as possible about symptoms and exposure. And when it comes to exposure, we follow the CDC guidelines. But I have a feeling that this up and down constant of COVID surges and vaccinations, whether or not they're effective or not, will be kind of a continuing trend as we go into 2023.
Yeah.
Can I just do a follow-up question to you, Josh, to you and to Doug? I know that, from talking to both of you when COVID hit and during the pandemic, you were saying one of your problems has always been you're blessed with an abundance of clients. Your issue is providing the service because of getting the folks, the staff folks, and that it's kind of accentuated because of the nature of your model. So you're consciously hiring seniors. That's the point of it, seniors helping seniors, which I think, as you know, I've always thought this was a great model. So I guess the question is, has that more resolved itself? Because I know that you had both said that, wow, over the last few years, getting folks was even harder than usual. I think, Josh, you mentioned one of the reasons, people aren't desperate for a paycheck. They're doing it in many ways. Folks are retired and they just want to be doing something they feel is really useful. But so I'm curious as the reaction from both of you on that, because you're there on the line all the time. And I'm interested from Betsy's perspective, whether finding folks who are, willing to work, whether it's been harder to find folks. But Josh, and Doug, what do you think?
I'll let Josh answer that. He's closer to it than me right now.
Yeah, so hiring continues to be our number one obstacle and challenge here. And certainly we have seen an uptick in applications come in and an interest in working for us as we have all learned to live with COVID. But there are certain things that have somewhat changed when it comes to our workforce. And childcare, caring for grandchildren has become somewhat of a competitor for the work that we do. As costs of childcare have gone up substantially, as well as people, parents returning back to the workplace in person. So the demands for grandparents to take on some of the caregiving responsibilities have been somewhat of a competitor with us. In addition, the workforce challenges that are plaguing the whole country are not unique to the healthcare sector. They're really happening across multiple sectors. And what we're finding is those that are retired, who would normally be a wonderful addition to our caregiving team and working as a companion and personal helper, they're actually going back to their previous industries as they're getting recruited to return back, as they are finding themselves, other industries are finding themselves short-staffed and realizing that this is a wonderful opportunity to bring knowledge and insight into their team. So I would say the grandchildren competitor, as well as their previous industry as a competitor, continues to make hiring a big challenge for us.
And speaking as the person who is about to go play with the grandchildren, and that's one of the reasons why we're all here in Martha's Vineyard, I can appreciate there's certainly a draw to that. There's certainly a draw.
Yeah.
Betsy,
Doug,
are you
yeah,
finding?
Betsy.
Yep, same here.
Yeah.
We're also, having challenges hiring people. It's a lot of money spent on Indeed. They seem to be the ones that are making it big right at the moment. But we've been able to find some people that are, the kind of fit the model that we have. We are in the process. I think many of you may know that we outsource our care to a third-party visiting nurse agency. And we're in the process of switching that agency actually from Aveanna Healthcare to Mary Ann Morse Healthcare.
Oh.
Yeah, so that's a big important move for us. Mary Ann Morse is in our market. They already, before we joined them, they already were hiring 360 nurses and personal care attendants. So they've, they understand the market. Aveanna was in a little bit of a different market, pediatrics, and hoped to get into senior care, but it didn't really work for them, I don't think, long term. But this opportunity for us, to bring in Mary Ann Morse is going to be great. I think our staff are feeling more and more engaged as we're moving towards October 1st is the date of that transition. Aveanna has done a good job for us. It wasn't that we didn't like them. It just worked out that it was a good opportunity. We're a not-for-profit. Mary Ann Morse is a not-for-profit. There's a lot of good blending opportunities there.
So Doug, can I close with an ad here? I know,
Sure.
and you can't do it because you'd be adding for yourself. These are both great organizations. So this is a pitch. This is for all of the seniors who are watching and thinking, well, geez, I wouldn't mind, working a little bit, and doing some stuff. And these are both great organizations, right? They're both, Josh has been around now for a long time. He doesn't look that old. He's really old, right? He's been around a long time. Betsy's, that New Horizons just been an amazing institution. I live in Marlborough. I remember doing the original permitting for that facility as a lawyer 30 years ago. You were talking about almost 30 years ago. These are, and you're working there with folks who are, who really appreciate being worked with, it's just very, very rewarding. And so for both of them who are looking for more and more folks, you may want to talk to them. And Doug, this was a great idea to have, to have these folks come back and just give us a sense of, once again, as as the pandemic becomes the kind of more endemic, how we look forward on all these issues.
Mhm.
It's just really important. So Doug, thank you very much for this. Josh,
You're
thank
welcome.
you. It's always a pleasure. Betsy, nice to see you.
Thank you,
And
Arthur.
folks, listen, that, this is not a paid ad, but you should talk, but if you're interested, you should talk to either one of these folks. And maybe we can ask the folks from Southborough Cable to put your contact information
Sure.
right on this show, so that if anybody wants to reach out to you, they can. Okay,
That'd be great.
that'd be great. Thank you. And
Thanks.
thank you,
Terrific.
folks.
Okay.
So much.
Thank you.